Well, initially when I was trying to decide what specialty I was going to go into, I wasn't sure if I would choose ENT right off the bat. I had considered other subspecialties, and once I rotated on an ENT service, I saw that ENT really is a combination of so many other different things. We have overlap with neurology, with endocrinology, with trauma, with orthopedics, and we do quite a lot of close work with the neurosurgery team when we're looking at lesions or tumors around the skull base. So for me, ENT just seemed to be the best meld of a lot of different things and really encompassed my interest, and I pursued it. Now, you know, the ear, nose, and throat area is what we refer to as ENT, is really more disorders of the whole head and neck. And looking at common things that we treat, from ear infections to sinus infections and problems, nasal polyps, thyroid and parathyroid disorders, parotid glands, and even skin cancers. Really, there's a whole spectrum of different situations out there that we address. And our patient population includes children to adults of all ages. And so for me, that was really the big draw, and looking at the impact that we have in the lives of our patients from an ENT perspective is what kept me, what keeps me going, and what kept me drawn to ENT when I was looking at deciding what specialty I'd go into. As a general ENT, I like the fact that I'm able to see patients of all ages, from children to adults, and I see the full spectrum of head and neck problems here. We're one of the larger ENT groups in the country and the largest one in Central Florida, and in so we are able to handle all the subspecialties within ear, nose, and throat as a specialty. Although we're a private practice group, we do have academic interests and hold tumor boards and other conferences to stay current on up-to-date treatments, technology, and really the standard of care, which is what drives us in taking care of our patients. Well, a new patient can expect that they're going to get a very direct but compassionate approach to their problem from me. I remember growing up going to the doctor numerous times with my parents, and the doctor would talk to my parents, but they wouldn't really get an idea or understand what they were being told, which then increased their level of anxiety and mine as well. So one thing I think is that if a patient is able to better understand the situation that they're in and understand the treatment, then it really lessens the anxiety and affords them really a better chance at following the treatment specifically. One thing that I do encourage new patients to do is to access our website and use the electronic portal online, where they can fill out a lot of the new patient forms prior to their visit. This really streamlines the process, because after about 60 years of doing things the old-fashioned way, we're now going to an electronic medical record system, which offers really better continuity of care for our patients on off hours, if they're to leave the area, or on weekends. But it also is environmentally friendly. So that can help expedite their check-in process if they do some of that before they come into the office.